It's Breast Cancer Awareness Month, so it's a good time to talk about the importance of potentially life-saving mammograms. Dr. Robert Perez, a breast imaging radiologist from Radiology Associates of Hartford, joins me now in studio. Good morning to you, Dr. Perez.
Good morning. Thanks for having me.
Nice to have you here. So important. Now, you are a breast imaging radiologist. What kinds of things are you looking for when you're looking at mammograms?
So when we look at mammograms, we look essentially for three things. We look for calcifications, which could be an early indication of breast cancer. We look for maybe mass densities that should not be in the breast, and also distortion of the pattern of the breast too can be a sign of cancer. So we look through all the images and we see if we see any of these findings, and if they do, then we do additional imaging to see what else might be there. All
right, so before you get to that point, you obviously have to go there and get a mammogram. A lot of women have never had one, or maybe they're due for one. Just explain what that process is.
So the day when you arrive for your mammogram, typically you come in, the tech brings you into the room and has you undress, and the mammogram is a machine, a stand-up machine, where you put your breast into the machine and perform compression on the breast in one view and then on the other. And then we do that for the other breast as well.
And women shouldn't be fearful of that pinch. Everybody talks, oh, it hurts so much, but it's just a few seconds, right? And kind of worth it.
Correct. Yeah, I mean, it's the best screening tool we have for breast cancer. And very rarely do I hear any complaints about breast pain from the procedure.
Okay.
And and it's a very quick image. The breast is only compression for a few seconds.
What are the current recommendations? When should women start thinking about this? Is it still age 40?
Yes, the current recommendations are age 40, start your screening mammogram, unless you had a strong family history of breast cancer. So if your mother or grandmother was diagnosed with breast cancer in their 40s, then you should start 10 years before they got diagnosed. So if 45, your mother had breast cancer, you should start screening at 35.
All right, so good time to have a conversation with your doctor to really figure out where you stand and what your family history is.
Correct.
And unfortunately, it happens. You do see problems on the imaging. What then happens to the patient?
So I know a lot of patients out there will understand this. You get a report saying we found something abnormal, come back for additional views. It's
got to be a terrifying letter to get.
It is. There's a lot of findings that we see on mammograms that might be related to compression, or just a different way that tech took the picture.
So it could be a false positive.
It could be nothing.
Okay.
So, but what we need to do is just, most of the time, we just do additional views to make sure that those findings were indeed nothing. And hopefully that's what it is. So that's why when we call patients back, is we're just working on a few images that we have, and we just need a little bit more information just to really see what was happening.
So all's not lost. Don't panic if you get that. That's just the first step. It could easily go the other way. And
it does most of the time.
And it does most. That's wonderful. That's very encouraging. Because I think a lot of women might be scared to go get one, fearful of what the result might be. Most of the time it's going to be okay. That's what you have to remember.
Oh, sure.
So are there any problems with mammograms? I mean, what about people might be fearful of radiation, or again, those false positives?
Yeah. Right, so radiation is a concern. There was recent concern about putting a thyroid shield on from some in the media. The radiation from mammography is considered quite low.
Okay.
Maybe a standard mammogram is about worth 2 or 3 X-rays, but certainly not as much as a CAT scan. So there is some radiation involved, but it's considered low level. In terms of the limitations of the exam, it's not a perfect exam. We wish it was. We miss about 17% of cancer on mammography.
It's just not a perfect science. Everybody's doing the best they can.
We wish it was.
Yeah.
We wish it was. So, I mean, that is its limitations. But we have other tools that we use in conjunction, including screening ultrasound, sometimes breast MRI, and as well as it's very important to get a clinical exam as well, just to better our services and our sensitivity for detecting breast cancer.
All right, lots of good information here, Dr. Perez. Thanks so much for coming in. We really appreciate it.
Thank you very much.
And we have something for our viewers. NBC Connecticut and Radiology Associates of Hartford, partners in a caring community. We're having a free mammography clinic this Wednesday, October 24th. It's happening in Glastonbury. And it's all day from 7 a.m. to 7 p.m. So we hope you can make it. You can make an appointment by calling the number right there on your screen, 860-714-2724.